Nur NADHIRA binti Nur HAKIMI A195886.
NURUL ADILAH binti ZAILAN A194556.
Tanbensin A196208.
NOOR ATHIRAH binti RADUAN A196234.
GABRIEL PUDUN SELUTAN A195301.
Assalamualaikum and a very good day. I bid to everyone here. I'm Nur NADHIRA as your moderator for today, and it is my biggest pleasure to be here today to talk about our topic today, which is pervasive culture of staff bullying among healthcare workers. Bullying has become very common in society today and not enough attention to. Hence why we've invited 4 panelists today, which are Ms. Nur Adilah binti Zailan, a nurse from Tunku Ampuan Rahimah Hospital, Kelang, Dr. Tan Versin, doctor from Hospital Kuala Lumpur, Dr. ATHIRAH binti RADUAN, a junior doctor from Taiping Hospital, and also Mr. Gabriel Pudun Selutan, a Secretary General of the Ministry of Health Malaysia. They are invited to give a story and own opinion on this topic. So I'll start off by saying that bullying can be defined as persistent, and abusive, insulting behavior, abuse of power, or unfair penal sections, which makes the recipients feel upset, threatened, humiliated, or vulnerable, and they may cause them to suffer from stress. Researchers and others have identified 5 categories of bullying, which include to professional status, such as public professional humiliation, threats to person like name calling and insults, isolation from information, preventing access to opportunities, overwork including impossible deadlines, undue pressure to and distribution on failure to give credit when assigned to meaningless tasks. So bullying is a universal phenomenon that occurs in various professions, and the medical profession is by no means an exception. So there is evidence that medical doctors in training, consultants, and significant its adverse impact and well-being of the affected individual. It has also been associated with high levels of job-induced stress, anxiety, and also depression. This can cause insecurities and lack of activity. So staff who have been bullied and have also been found to have significantly lower levels of job satisfaction are more likely to have intention to leave the job, right? Because bullying has more recently been associated with the reporting of potentially serious medical errors. Various prevalence rates of bullying in the medical profession have been reported, and depending on the definition of bullying used and the population survey, the time frame within which bullying has occurred. Although bullying among doctors has been studied intensively in the development, very little attention to the, especially in the developing country. So, in this topic, in medical field, we know that nurses and doctors has been bullied throughout their work time frame, right? So, I want our first panelist, which is Miss Adilah binti Zailan, which is a nurse herself. So, can you tell us more clear about the reasons behind why bullying among nurses has become a culture? Can you give your opinion?
So thank you, moderator. To be honest, I'm so glad to be one of the panelists here. A very good day I bid to all panelists and our moderator. So, when asked the question, what is one chronic and painful problem in your industry that no one seems able to solve? And my response was, that's easy. It's nurses bullying nurses. But the real question is, why do nurses bully each other? It seems like a ridiculous notion that nurses can be so kind and caring to its patients, but so horrific to each other. Let's just say it's rare to find a nurse who hasn't been bullied in some way. I wish I could say that nurse bullying is decreasing, but unfortunately, it's not. Recent research also shows that nurses are experiencing greater workplace bullying and incivility now more than ever before. And again, I ask, why do nurses bully each other? So, nurses bully each other for three main reasons. Firstly, we are a female-dominated profession, and women aren't always that nice towards each other. Women are often negative towards other women, not just in nursing but in life. This behavior can spill over into the workplace as females compete over status, respect, and also position. It wasn't all that long ago that we were competing for the prize meal, so women are used to trying to make other women look bad. My second reason is nursing exists in a forced hierarchy. Like physicians rule the roost. After all, it wasn't that long ago that nurses had to give up their chairs for the physicians and weren't respected as a profession. Low status creates a sense of powerlessness and helplessness, leading to low self-esteem. This also leads to reason number three, which nurses work in high stress environment. When under stress, we're not always on our best behavior, right? So think about the life and death situations in healthcare and unpredictability of patient care. You never know what you're going to get when you walk into the door. Things can change dramatically hour by hour, and we were being asked to do more and more with less and less. The result is a group of highly educated, highly stressed individuals who haven't established good coping mechanism to deal with this stress. So what do they do? They lash out to each other. So how does nurses to nurse bullying typically show up in healthcare practices? Keep in mind that not everything is bullying. Sometimes it can be teasing, being rude, or inconsiderate. For a behavior to consider bullying, it has to repeat. Like our moderator said, a common definition of bullying is the repeated patterns of destructive behavior with the conscious or unconscious attempt to do harm. So, bullying is if there is a target, harmful, and repeated, like uneven workloads based on favoritism, deliberate exclusion, refusal to help, silent treatment, or sabotage and setting someone up to fail. So why does nurse-to-nurse bullying take place? Nurse bully because they can. First, because we accept the behaviors as the norm and fail to recognize bullying behavior. We say things like, that's just the way it is nursing. Sometimes we say to others, well, that's just how she is. Don't take it personally. Second, when the employees are bullied, they don't speak up. 40% of all targets don't tell anyone they are being bullied. And this silence occurs because of the fear of retaliation. Targets are afraid that if they speak up, the bully will find out and retaliate against them. And lastly, the leaders use silence as a strategy. Nobody teaches the leaders how to address the bad behavior of their employees. Yet 85% of the manager's time is spent dealing with the behaviors of their employees. And so, the cycle of nursing to nurse bullying continues.
Thank you very much, Miss Adilah. So, what I can say from what Miss Adilah has said earlier, women are underrepresented in the nursing field, and they aren't always kind to one another, right? So, low status breeds feeling of helplessness and importance that lowers one's self-esteem. So, we do not always behave well while under stress, under pressure. So, the end consequences is highly educated, very stressed people who lack effective coping strategies for stress. So, nurses who can bully do so. As being repeated by Miss Adila and also me just now, repeated patterns of harmful behavior with the conscious or unconscious desire to inflict harm is a typical definition of bullying. And it's also been said that 40% of the targets never bullied to anybody because they are afraid of um they're afraid, and they believe that the bully would react if they speak up. So they remain silent. No one instructs this leader on how to deal with the poor, so that the cycle of bullying between nurses continues. So we have looked at the reasons why the bullying among nurses has become a culture from Miss Adilah. So I think we can continue by asking the second panelist. Can you give us a clearer vision on what exactly bullying and what is actually from the senior doctor to the junior doctor? So I want to ask if you can define what is the fine line between guiding and bullying exactly.
So we all know that senior doctors play a very important role model in developing a competent junior doctor, especially in their early careers. So these senior doctors serve as a mentor and a guide. And we can all understand that they have strict standards to adhere to, especially in fields like medicine where you're dealing with someone's life or death. Because one tiny mistake can cost someone's life. However, it's crucial to distinguish between bullying behavior, which is hurtful and degrading, and also effective supervision, which can be beneficial and also empowering. So before we dive deep into the fine line between guiding and bullying, we should know how to recognize forms of bullying by senior doctors. And some forms of this bullying include name calling, using derogatory language, public professional humiliation, and even sexual harassment. So these are forms of personal attacks, which is different than guiding someone for the better. And all this might have stemmed from the senior doctor's aggressive training in the past. So this means that the senior doctor might have experienced aggressive housemanship training in the past by their previous senior doctor. So as said by Pace and Firth Cousins, if you feel bullied, you are more likely to bully others. Besides, if we include current factors, they might be bullied by their current consultants or their current senior managers too. So to overcome this, the senior doctors must be aware of generational change and reflect on their methodology to determine if their methods are too aggressive for our generation of junior doctors. So when mistakes are made, some form of correction or scolding must be done. However, as we said, there must be a fine line between guiding and bullying someone, and the purpose of supervision must be clear. As an example, when a junior doctor makes a mistake in a ward, the senior doctor should not curse at him in front of the patients, as it will humiliate him, instead of teaching him and guiding him. Instead, the senior doctor should demonstrate the correct treatment in private and scold the doctor in private. If the mistake is too serious, then the senior doctor has the right to bring up this case for disciplinary action. Apart from that, senior doctors should not be afraid to call out their colleagues for inappropriate actions when they see one. As a conclusion, when junior and senior doctors unite regardless of position, gender, and race, then healthcare providers can provide higher quality treatment for patients, with which then healthcare workers can break the chain of negative reinforcement role modeling and produce a generation of more competent, resilient, yet empathic doctors. After all, doctors are just ordinary human beings who are risking their life to save others.
Okay, thank you, Vincent, for the opinion. So now we do understand that doctors has high standards in medicine. High standards in medicines are totally acceptable, especially when the lives of patients are. It is important, but it is important to distinguish good supervision, which is advantageous and empowering, and bullying behavior, which is unpleasant and demeaning. Name calling, public professional humiliation, the use of insulting languages, and sexual harassment are a few examples of bullying by the senior doctor towards the junior doctors. So, um, apart from all these situations, I want to ask our third panelist, Dr. Nur Atira binti Radwan, which is actually a junior doctor herself. So, can you explain that these situations going on about the bullying and all? What are the effects of uncontrolled bullying? What, like, how does it affect the victim that are being bullied?
So, thank you for the moderator and all the panelists for giving me this chance to speak as on behalf of junior doctor. So, junior doctors have been bullied for years by, especially by senior doctors, and we know that this culture is getting serious and alarming. So, years of studies have shown that majority of junior doctors in Malaysia alone have experienced bullying in their workplace. So, in addition, almost 1 in 4 of the younger doctors admitted to having had suicidal thoughts because they could no longer tolerate with this bullying. So, in fact, the houseman had fallen to his death just 3 weeks after being posted at the hospital. For example, in 2018 report, a survey showed that 79.63% of junior doctors in Malaysia experienced bullying. And it is said about 17% of junior doctors had thought of ending their lives because of bullying. While some young doctors may attempt suicide, others also may have suffer from long-term emotional trauma due to lack of self-confidence, and they even had mild depression. So the developed depression due to post-traumatic stress disorder could lead doctors to consider quitting their jobs. And even worse, junior doctors experience acute stress when they are insulted in front of patients. I really believe that no one should be scared to go to their work because enjoying our work would increase quality and productivity of the work. In Malaysia, a trainee doctor has to undergo housemanship before being confirmed as a medical practitioner. So every houseman will go through 6 postings every 4 months. Therefore, it isn't worth it when doctors are emotionally exhausted due to their own colleagues rather than the job itself which they have to work for 13 to 15 hours. And junior doctors will become demoralized and need treatment for the rest of their life. Moreover, some bullies even target attractive juniors, which may result in sexual harassment, just owing to possible sexual preference and jealousy issues. While some might think that this kind of perception isn't going to happen as professionals, but it is just getting critical over years. So bullies could occasionally believe that juniors have to be taught a lesson since they seem arrogant, but they actually don't. Sometimes bullies also have the perception that junior doctors who are too smart or too rich that makes them seem arrogant. Hence, the bullies will feel like the junior doctors must be taught a lesson in humility. On the other hand, since human resources also do not really help employees and healthcare workers, especially the junior doctors, the government should take all the necessary measures to stop this bullying culture, especially the health ministry and medical professionals across the country. This is imperative in order to maintain the well-being of the healthcare workers that have sacrificed and contributed a lot to health industry.
Um, Thank you to Dr. ATHIRAH Binti RADUAN. So, we do know now that junior doctors have been bullied for years by senior doctors, and this culture is getting serious and worse. Because almost 1 in 4 of the younger doctors has admitted to having suicidal thoughts because they could no longer tolerate this bullying. So I really believe that, as Dr. Atira has said, no one should be scared to go to their work because enjoying the work could increase quality and the productivity of the work itself. Right. So, um, moving on, we have talked about the reasons, the actual fine line between and also bullying, and the effects on the victims itself. So now the main reason we've invited Mr. Gabriel um, to to our discussion today is because as a representative from the Ministry of Health itself, can you tell us exactly what has the Ministry of Health been doing to take care of the situation honestly? Like, what are the enforcement taken by Health Minister to put an end to this issue?
It's an absolute pleasure to be here today to be discussing this important issue together with the other panelists. And as we all agree, workplace bullying at Ministry of Health hospitals is unacceptable because bullying harms individuals and directly threatens public health as it may lead doctors, nurses, and other healthcare professionals to leave Ministry of Health hospital. The working conditions are already challenging with high workloads and large amounts of soul-crushing paperwork. A work environment that is hostile, toxic, or bullying may be the last straw that sees health professionals leaving Ministry of Health hospitals. Bullying is a serious issue with impact on individuals and our health system. And in this case, Ministry of Health is always alert and committed to tackle this bullying culture. So in 2022, the Malaysian Health Minister, which is Khairi Jamaluddin Abu Bakar, once highlighted that there should be a zero bullying and harassment policy at all workplaces. This policy will preserve human dignity and protect the subordinates from being treated with contempt or in ways that will make them feel insulted. Also, during his speech in Rembau, he also urges that information of workplace culture is needed to overcome bullying among public health sector workers, and changes done will underscore new principles and workplace culture values to be adopted in the health ministry. Also on May 12, 2022, during the Ministry of Health International Nurse Day 2022 event, the Health Minister Khairi Jamaluddin said that all complaints about the workplace bullying of trainee doctors will undergo formal investigations as action cannot be taken solely based on claims on social media alone. These complaints will be investigated by an independent task force and also Ministry of Health's integrity unit that probes disciplinary issues that will curb criminal misconduct and breaches of the code of conduct, also organizational ethics among civil servants. The health minister stressed that although he took all allegations of bullying of house officers seriously, formal or transparent investigation must first take place before action can be taken. On May 13, 2022, the Health Ministry announced the official formation of the Independent Healthcare Work Culture Improvement Task Force, or in short form, HWCITF, to look into matters such as the death of a trainee doctor in Penang Hospital, amid reports of bullying incidents and mental stress faced by healthcare personnel. He then said that this newly formed independent task force would therefore cover aspects of work culture and the management of healthcare staff personnel to ensure the delivery of quality and professional service. In addition, the ministry insists to provide its full commitment to the independent healthcare work culture improvement task force to come up with steps to improve the whistleblowing system within the ministry. Whistleblowing system, or WBS, is a reporting tool BRI personnel in particular and the public to report any behavior or actions that were indicated to have violated the Code of Conduct, GCG principles, and both BRI internal applicable regulations and prevailing laws by BRI personnel. Dr. Nur Hisham Abdullah says that the system is already there and is under maintenance to enhance its effectiveness. Among them are ways to lodge reports so that whistleblowers are protected. To conclude, work pressure could help junior doctors and nurses to adapt to important tasks, but not to the extent where bullying, humiliation, verbal, mental, and physical harassment took place. Guidelines and work ethics were important, but ensuring that those guidelines were adopted in the workplace was more important. And also, every organization must clamp down on bullying and harassment and not solely depending on health ministry.
Okay, thank you, Gabriel, from the Ministry of Health. So, we all do know that bullying hurts people it poses a direct threat to the public's health since it may cause medical staff members like doctors and nurses to quit their jobs. So, as Mr. Gabriel has said, the Malaysian Health Minister before has Khairi Jamaluddin Abu Bakar has once emphasized that the need for a zero tolerance policy against bullying and harassment at all workplaces in 2022. So this policy uphold human dignity and shield subordinates from disrespectful behavior and other actions that can. Also, Dr. Nahisham Abdullah has claims that while he takes all claims of bullying seriously, no action can be done until a proper open inquiry has been conducted. Um, so the enforcement of the health ministry insists that on giving the independent healthcare work culture improvement task force, as said by Mr. Gabriel, which is HWCITF, will give its full support in order to develop measures to enhance the whistle within the ministry itself. So, um, what we can conclude from our discussion today about the pervasive culture of staff bullying among healthcare workers, we can say that bullying is akin to an endemic disease that runs across borders and cultures. It is also prevalent amongst the medical community and also professional research, teaching, and administrative fields. So the comments by seniors on the failures to meet the standard of expectations are felt as being bullied by junior colleagues. So the former thing that and the comments are inevitable part of the relationship between trainee and also the trainers. But the feels bullied by such behavior that the accused perceived as reasonable. So such disagreement seems to be the doctor's additional dilemma, especially in a teaching institution. However, it is pertinent to note that even perceptions of bullying can have a negative impact on the overall climate and outcome of the workplace. It has been reported that bullying others was related to aggressiveness, um, self-esteem, and anxiety. So, a positive and significant relationship between depressive symptoms and bullying others was revealed for both boys and girls. All the same for whether you're a boy or a girl. Scenario, it is who are presently being bullied could turn out to be tomorrow's bullies. As said by second the second panelist. Um, so at this juncture, it is pertinent to mention that the results of the present study should be considered preliminary. The problem of bullying needs to be addressed in the earnest. So a few measures for tracking the issue are suggested, such as acknowledging the sense of the problem could be the starting point. Next, bullying policies need to be developed by the Ministry of Health uh, and also be implemented. So as of now, no such policies have been enunciated yet. So this standard behavior within the workplace, which could include a commitment on the part of employees to interact and communicate it to all employees, especially the medical fields, right? So sessions could be used to increase the awareness of bullying as an organizational problem. So victims should be provided with support and access to dispute resolution procedures. Measures like teaching the appropriate skills to those who deal with bullying, personal development or consultations, or other who interact inappropriately. Programs for trainees to tackle bullying effectively, appropriate reward punishment for the concern. These developing role models will also be helpful in this regard. So um, that would conclude our discussion on our very interesting topic today, which is the pervasive culture of bullying. So I would like to thank all of our panelists for today, for giving such good own opinions on your part, because each of you has already uh, experienced them yourself. So I think that's all for our discussion for today. Thank you